My daughters and I were planning a trip to Italy. We were so excited because we have not had a mother-daughter trip like this. One day I was at the gym, and as I was running, I felt a pop, and all of a sudden, the trip that I had been planning came to a halt. When I received the results of my CT scan, Dr. McKay showed me that I was bone on bone, and I didn't have a choice but to have a knee replacement.
Bev, as far as knee replacement patients go, on the younger end of the spectrum, and she's an active patient. So I want to help her get back to those same levels of performance that she was able to do before. And that's why I offered her the custom knee replacement.
It was about 3 hours after surgery, my nurse came in and said it was time to get up and walk. And so by that evening, I was able to walk the whole floor. And everybody was there cheering me on, and it was fun. It was just a lot of fun, that's all. Who thought having surgery would be fun?
So she rehabbed very quickly, and she has bounced back basically to 100%.
With the team-centered approach at the Methodist Joint Center, surgical outcomes are optimized, and we have excellent results, very low complication rates. Patients get back into their daily activities very quickly compared to the way we did things 10 or 20 years ago.
7 months after my surgery, I was able to take my trip. While in Italy, we walked everywhere. Knowing what I know now, I would have had my knee replacement done long ago. It feels really good to be back to my active self. My name is Bev Bergen, and I count on Covenant Health.